Hello everyone, I am Dr. Vinayak, Consultant, Department of ENT, Dr. Rohit, Lead Consultant. We are from Department of ENT and Hearing Implantology. We are here to discuss today about hearing, hearing care and an event called World Hearing Day. So Dr. Rohit, what is World Hearing Day?
World Hearing Day is basically an event which is celebrated on March 3rd of every year.
Okay.
World Hearing Day is organized by the World Health Organization. There's a Department of Prevention of Blindness and Deafness. The office of this department initiates this event every year. A major event is celebrated in Geneva every year. This World Hearing Day has a theme. Every year the theme is different, every year the theme has got a meaning, and every year the theme is connected to the day-to-day issues that people face with hearing. So World Hearing Day theme for 2025 is as follows, is basically changing mindsets to empower yourself for better hearing and ear care for one and all. So this is very, very important because every year it keeps changing, but every year it adds value to the previous year's the theme, and it takes the way forward for better hearing for all.
Suppose a person comes to you for a OPD in hearing loss, how do you go and assess him?
So people who visit our OPD can be of varying ages. They can be small children, they can be newborns, they can be adults, they can be elderly. First of all, we need to make sure that each person who comes with a hearing issue, especially a hearing issue, is treated with a lot of sensitivity and a lot of care, and he or she needs to be addressed even for the smallest issue they describe with their hearing. When a person comes to us with a hearing issue, they need to be first taken care with a lot of empathy. They need to be evaluated, they need to be examined, their ears need to be addressed completely. They need to be listened to before doing anything else because they have a lot of questions about their hearing and the difficulties they face with their hearing. Sometimes it may be a child who may not be able to speak at all. So whatever the parents or the caregivers come with the patient, when they express us their difficulties, it has to be listened to completely before coming to any form of judgment or any form of a treatment option for the patient. Once we look at this aspect of the patient, we need to assess their hearing through various modalities that are available in today's world, which will give us an idea what is the hearing level and where is the hearing loss positioned at this point of time, what would that hearing loss mean to the patient. These are important aspects that need to be looked at. So we will look at checking all of these aspects when the patient comes to our hospital.
So you mean that hearing can occur from birth till death anytime. So in all age groups we see hearing loss. Supposedly the all age groups have the same hearing loss. So you go through the same assessment protocol, or is it different for pediatric and adult age groups?
So when we look at hearing assessment protocol for newborns, we have hearing assessment protocol for newborns. So the child can be evaluated on the day of birth. So we do something called as a otoacoustic emission test. This comes under the Universal Newborn Hearing Screening Program, which is implemented all over the world in all hospitals. It is mandatory to be done because it will first enable us to identify a child who would have some form of hearing loss or not. Also, it will guide us on assessing those children who are high risk pregnancy, children who have been born out of high risk pregnancies, who do have certain issues, or the mother had issues during the pregnancy or during delivery. Those children will be taken more care when we get to assess them with the hearing evaluation, which basically is otoacoustic emission. So when we are able to assess this right at birth, nothing holds us back in providing a child with hearing options as the child grows up. When it comes to evaluating a child below 5 years of age, after 3 months of age and up below 5 years, we have various hearing modalities, evaluation modalities, which can be brain evoked response audiometry, which can be an ASSR, there can be a behavioral audiometry, there can be multiple options available to get to the point of the exact hearing level for the patient, which is of course a child. When we have a child beyond 5 years of age, they can comfortably be evaluated using a pure tone audiometry, which is subjective, which is not objective, which is based on what the patient gives us a response. We also engage adults in the same way with pure tone audiometry. We also can engage them with a BERA test or an ASSR to get a deeper analysis of the hearing levels in these patients.
So now I understood that there can be some assessment in the pediatric different from adult as well. Yes. Now coming to adult age group, is it well discussed at home when a person is having hearing loss at home? Is it discussed?
Most of the times when we look at adult hearing loss, or more specifically geriatric hearing loss. So when we look at geriatric hearing loss, they are the elderly or the people who are above 60 years of age who do have age-related hearing issues, which can be progressive, which can be of gradual onset, slowly progressive, or they could have had hearing issues in their adult life which has progressed and got worsened when they reach this geriatric age group. Most of them fail to express themselves to their family regarding their hearing issue because they don't consider it so important when it comes to speaking about it, or talking to another person, which can be their own child or their own family member, that they seem to be having a hearing loss, because most of the times it is either the ego of the person that comes in the way, especially in our societies, or it can be that it could be a taboo for them to express that they cannot hear because of their social status or whatever it could be. That's something which they do not express so frequently at their homes. They try to keep pushing it as much as possible until and unless they come up with other issues like memory loss or depression or poor socialization, where they don't participate with people in events and day-to-day activities, is when they realize that they are in trouble. And by the time they realize in trouble, actually the family knows that the person is in trouble. So it's something which is not very commonly discussed because of a lot of taboos.
When a geriatric person has a hearing loss, does the person himself comes to you, or the family member gets to you to the hospital for consultation?
Yeah, so when we meet such patients, when we inquire about the hearing issue of such patients, and when they come to us, when we sit down with them in detail and ask them about their issues and how do they find out, a lot of the times we find out that the family members are the ones who bring them across to the hospital, because as I told you, most of the geriatric or elderly consider it a kind of a taboo to express that they have a hearing issue. Especially when they're retired or when they're no more working, they seem that it's not an important thing to be discussed with anybody else, and they're comfortable with their lives. Most of the family members do struggle to express things to them when they communicate on day-to-day activities, when they communicate with them for small work-related issues at home, or when they need to attend certain small functions or group events. They find it very difficult to communicate with them. A lot of misinterpretation happens when conversations are happening at home. They mean to say something else. The person with the hearing issue understands it differently. So a lot of conflicts happen sometimes. So in such scenarios, most of the times the family members will bring them across for a hearing evaluation. There are certain elderly patients who do visit us on their own accord, because they are very active socially, or they are still working because they are involved in their activities every day. They are still earning for the family. They start visiting us because for them hearing is very important. Hearing plays a significant role, because some of them can be like judges, some of them can be still doctors, some of them can be owners of companies, some of them can be just as simple as a temple priest, can be people who engage with a lot of other people every day, where they need to communicate on a day-to-day basis. Those are the kind of patients who come to us straight away because they do not want to miss out on certain things.
So what do you want to do further when a person comes with a geriatric person comes with a hearing loss?
So when the geriatric patient comes to us with the hearing loss, most important for us to know is the duration of the hearing loss. Has he or she addressed the hearing problem that they have? Do they also have other psychological issues like depression? Are they starting to get forgetful? Do they seem to be having memory loss? You need to you can't just look at their hearing aspect only as an individual entity and then just say that, okay, you have this kind of hearing loss, you need to have this kind of hearing option. it is not so easy to enforce that hearing option on them when they are coming to you with a hearing loss. We need to understand their psychological status also before prescribing or giving them an option for a hearing solution. The hearing solution can be variable. Some of them may not accept a wearable option of hearing solution. Some may look forward for medications. So, like I said, assessing them in totality is very important, because many of them will also be having other comorbidities for which they will already be on medication. So they will already be visiting hospitals for so many other reasons. So you need to handle them very delicately and then take them forward. Hand holding for such patients is very important.
So you said that there are some medications. Are there across whatever we have seen, there are no medicines for hearing loss as such? Because I come across so many people asking for medicines apart from hearing aid options. Do you have any options other than hearing aids for hearing loss in geriatric age group?
So depends on the level of hearing loss that a patient comes to you with. So in case it's an elderly patient who has a hearing loss, we have various options of hearing devices. The hearing levels can vary from mild, moderate, can be severe hearing loss, sometimes can be profound hearing loss also. Now, when it comes to medication aspects, a lot of patients who come across, they want us to give an option that, do you have any medicines for this? Will I get my hearing back to a better level if I take some medicines? Most of the times they need to understand that the kind of hearing loss they have is an age-related hearing loss, which is basically presbyacusis, wherein it is a slow degenerative process where the hearing drops down. The inner ear, which is called as cochlea, the reserve gets lower and lower as the person starts aging. That needs to be supported with adequate amplification. Preferably, they need to be supported with hearing aids. Most of the times they have hearing loss which are almost the same on both ears. Some of them come to us with different levels of hearing in both ears. Some of them may have absolutely normal hearing in one, some might have drop in hearing in the opposite ear. So everything needs to be addressed accordingly based on the hearing loss. So I would not look at having a fixed solution for every single patient, that this patient requires this or this patient requires this. Based on the kind of level that they project to us is what we need to address and treat them. So it can vary from hearing aids, can be varying from cochlear implants, can be bone conduction implants. A lot of surgical options and also non-surgical options are available. Medications as such for long-standing hearing loss, they want it to recover back, especially in geriatric age group. That is not an option that we are, which is something which is given to a patient because they don't seem to exist. That's something that the patient wants actually, but it is not what is available. So we need to treat this patient, again as I said, with a lot of sensitivity and provide them the best kind of solutions.
Suppose, now we know that there is no medicine for this. Suppose a patient is on long-term medications on certain things, there are some comorbs, and patient questions to you, are there any medications that cause hearing loss? Is there anything that is called as medication-induced hearing loss?
Yes, so there are certain drugs which are called as ototoxic drugs. There's a list of drugs which are always there, which can be varying from chemotherapeutic agents, which can be certain antibiotics, certain pain medications, wherein when the patient takes these medications on prolonged prescriptions, or the patient is taking these medications by self, without understanding the implications of the medication, we see that yes, they do present to us with a form of hearing loss which is called as ototoxic hearing loss, which is non-reversible hearing loss, wherein the functionality of the inner ear is completely lost and it happens rapidly. It progresses rapidly. It doesn't happen overnight, but it progresses rapidly. These kind of medications have to be made aware to the patients when they come to us, especially when they are on certain medications, when we speak to them in the history to find out what's happening and from when these things are there. Also, the medication history is very significant because it will give us an insight. Doesn't mean that just because this medication is causing a hearing issue to the patient, it should be stopped if it is a specifically prescribed medication, because if it is required for their living, you cannot have an option of negating that medicine. But if there are alternative medicines, they should be generally provided. These kind of hearing losses should be addressed with hearing devices or eventually cochlear implants, because they cannot be reversed back for any reason.
So Dr. Rohit, what is your take on sudden onset hearing loss?
Okay, so sudden onset hearing loss is seen in all age groups. So I will not label it as it's seen in only adults or in geriatric. It's seen from children to adults and all geriatric kind of age groups. Sudden onset means that the person was absolutely fine up to a point where one ear, or very rarely both ears, all of a sudden completely turn down and become almost absolutely non-functional. It is kind of a sudden shocker for the patient when they express this kind of a scenario where they feel that they cannot hear at all absolutely from one or both ears. As I said, rarely very both ears. It can be due to various reasons, and sometimes a lot of these patients, they think it's probably because of upper respiratory infection. They have an ear block or a tube block which is leading to some muffling of sound. Some of them feel that it'll just recover back and come back again in a few minutes to few hours. Some of them don't even realize that they have had an issue. They are not so aware of these things. They don't know that they have to come to us to take treatment for this option, or the issue of sudden onset hearing loss. I would label it more like a stroke for the ear organ. So if you take layman's term, like a stroke for the ear organ, where there has been a sudden destruction of the functionality of the inner ear. Nothing has happened to the inner ear as such, but the functionality is almost gone to nil. So the causes that can lead to this issue is a sudden exposure to a loud sound. They can have a sudden impact and cause an acoustic trauma and can have a sudden onset hearing loss. It can be either a viral or a vascular issue where the patient had a preceding viral infection, wherein after a few days of that infection and the patient wakes up, all of a sudden he feels that he cannot hear at all. There can be a vascular issue. There can be sometimes patient can be having a very high cholesterol level. Patient can also be having certain tumors, compressing on the nerve which exits the cochlea, which can cause a sudden change in hearing and cause a sudden onset hearing loss. These have to be addressed immediately. First 24 hours is the best time option to come to a hospital and get that evaluated, because there are a couple of treatment options that are available which generally tend to benefit the patient to help to revive the hearing if they approach us within those golden hours of a single day, or maximum maybe 48 hours, but do not delay beyond that point of time. Oral steroid therapy or an intravenous steroid therapy, or in patients who we cannot give this because of their comorbidities like uncontrolled diabetes or hypertension or any of the other issues where steroids cannot be given for such patients, then we give intratympanic steroid injections for the patients in sequential days, so that we try to reduce the inflammatory process that's ongoing in the inner ear and restore back the hearing. It's just like giving CPR to a patient who seems to be having a cardiac event and then reviving the person on time. If you do it sooner, the patient gets better. If it's done on a delayed time zone, you find that the patient is not so well recovering, especially when it comes to your cardiac status. Same thing applies even to the ear. The blood supply is compromised for some reason, the inner ear functionality is compromised for some reason, there's a sudden stunning of the ear. The recovery depends upon how immediate the responses are. They have to be addressed, they have to come to us. This cannot be neglected at any cost, because it can be easily salvaged if you come on time.
Okay. Now the younger generation is also facing hearing loss. Do you see anything in relation to headphones, earphones in this younger generation?
Yes. So when we assess our data of seeing hearing loss in all age groups, so we have patients who come between their 20s and 40s, we have patients between their 40s and 50s or 60s, and beyond 60 years of age. Now, some people whom we see who come to us for the regular checkups, hearing level checkups in the elderly age group, and they seem to be having a good hearing reserve, especially in the speech frequency, and just a kind of a marginal sloping zone in the high frequencies. I sometimes find it really amusing that they have better hearing than so many of the people of our age group or younger than us, because the current generation or people who are younger than us, the millennials or the so-called the babies who are there at this point of time, they are so accustomed to using these kind of hearing devices. So the teens and then in the early 20s, they are using earphones and headphones completely, in the irrelevant time zone, many number of hours, prolonged usage, high volume intensity, and using it for various reasons, just not for work. Some say it's for work, some use it for leisure, some just wear it because they just want to be lost, they don't want to get involved with their surroundings. These guys have hearing levels which are way lesser than the guys we are seeing, who come for hearing evaluation just as a health check. And it's really amusing to see that, because they are really damaging their hearing. So I'm really wondering what their hearing would be as their age progresses. So when they reach their 50s and 60s, we will have more work to do to take care of their hearings. I'm looking at hearing loss epidemic in the future. So by 2050, there is going to be more than 1 billion people on an average probably having some form of hearing loss or the other, which may or may not be recoverable, which needs complete assistance in the form of hearing device solutions. So I won't be surprised if we are going to encounter this, unless and until, like we say, with the changing mindsets as per the World Hearing Day, to make sure that a person is capable first to address their hearing issues and take care of their hearing, give more value and respect to the hearing, provide more care for themselves, kindly avoiding the form of insult that they give to their ear with the devices. Like you asked me, is it only devices that they're wearing? I don't even think it's only devices. Also the kind of environment they live in. If they're living in a noisy environment, it is something that we need to look at. The current day world in India is very noisy compared to many other countries. It's a high noise environment. So you need to be aware of how to take care of your ears, because that will make sure more longevity for the ears, and as well as better outcomes as you're growing older, rather than suffering and having to come to us to get yourself treated.
So how do you treat a baby born deaf?
A lot of the times we get patients who are congenitally deaf. So basically they don't have any form of hearing when they're born, and they are unable to speak as they grow up because they're not hearing. So this is something that is to be addressed, because you need to bring these children to mainstream, wherein they'll have to go to normal schools, they'll have to speak, they'll have to hear, a lot of things they'll have to do. Now if a child was born deaf, the world is upside down literally for their parents. So when we assess, like I told you, we can assess the parents, the children who come to us with this kind of hearing loss, we can assess them way early, as early as day one when they're born, following which we do sequential assessments with a BERA test, an ASSR. We do the radiological evaluations to know what's happening to their inner ears, just not the functionality. The function is down, I need to know whether the ear is even there or not, the inner ear is working. If it's not working, the structure, if it's available or not, for us to do something about it. Once we know that these things are set, meaning the child's development is all right, but just that the function is lost, we have an option which is called as a cochlear implant. Cochlear implant is basically done to help these kind of children to gain back their hearing, thereby enabling us to guide them to speak.
Okay. What are they actually? What are the cochlear implants, and how do they benefit the newborn child?
So cochlear implants are devices which are bionic devices, which are implantable solutions, which have two components. One component is the one which is implanted into the on the skull bone, where it has an electrode which enters into the cochlea. Every cochlea is like a fingerprint. So it's just not that only fingerprints are unique to a person. Every single cochlea in form of dimension and appearance is unique for every person. It's not the same. It's completely different. So these things are very specific for every patient. So the devices that we also insert have to be customized for a patient to get the maximum benefit out of the cochlea, which is the hearing organ. So when we look at the loss of functionality of the inner ear, where it is unable to convert the electrical impulses and send it to the brain, we need an alternative solution for that. When we know that the structure is available and the neural component is fine, or the nerves are all right, and then the complete pathway is okay, just that the cochlea is not working, we need to have an alternative. So cochlear implants are there in the hearing option array of options for a long time now, for almost more than 40 years it's been there. But it's been there in India for the last 25 years to 30 years. It has been there, and it's been on a large scale availability at this point of time, where the patient can avail the option and get it implanted surgically. The device is then allowed to heal underneath the skin, and there's an external device which is called as the sound processor, which will couple with the implant and then help to transfer the sound signals to the device, which will convert the sound signals at a very fast rate, which is almost the same rate as what the cochlea would do, and produce the electrical impulses into the electrode, which will be stimulating the cochlea and thereby helping the nerve to take it to the brain. So it's a complex device, but it does wonders. Main thing is it has to be done at the right age, as early as possible. The earliest that you can implant in India is around 8-9 months of age. Abroad they implant even at 6 months of age based on the size of the skull. It matters as how early you can intervene in the child and when you can diagnose the problem in the child. Some of them may come to us very late, at 3 years or 4 years. It's not that every child will come to us at 4 months or 5 months or 6 months and we have a wonderful life where we can implant them as soon as possible. When you know that they have this kind of hearing loss, how are you going to support them? Whatever age they come to us with cochlear implants, after treating them comes the therapy part, where you need to train them how to understand what they're hearing, and then comes a spoken language. Some of them might even require communication, other communication tools like total communication, because they're coming to us late. The idea is that you need to come to us very early. So awareness is very important for us. So more people are aware through various modes of channels of communication, one of this being our own podcast, is we need to make sure that they do come to us as early as possible so that we can intervene in the best possible way to give the best comfortable life for the child, as you asked me about children and hearing loss.
Okay. Is it really safe?
It is very safe if it is done in the right way, if all protocols are followed. Initially there was a little bit of a fear factor by a lot of parents and a lot of groups that didn't want to get this cochlear implant going, because as I said, it's just not about the treatment option. Now there are people who are deaf and who didn't have these options and who don't want surgeries. There are basically deaf communities. For them, sign language is the most important tool. Sign language is as important as any other hearing option which is given to patients where they can listen and speak. So initially there was a lot of resistance for this device to come up. Then once it's set up and then quality of life started improving, more and more people started accepting. Then came the factor of, is it going to be safe for the child? Because initially it was made for adults. Then it came into the pediatric age group. It is definitely safe if protocols are followed with respect to surgical techniques, with respect to right insertions into the cochlea, with respect to proper antibiotics, with respect to vaccinations. All of this make a group of protocols that we need to follow so that we have safe outcomes. Eventually, if you run a implant program, you have to have safe outcomes. To have safe outcomes, you should not miss any single step when you're trying to follow the protocols. Protocol is very important and definitely it is safe.
Now coming to bone conduction devices, can you elaborate what is it actually?
So now we do see patients in say pediatric age group. We see patients who don't have ears, like they don't have an external ear at all. They definitely will have anomalous formation of their ear passages along with the anomalous formation of the external ear. They will have sometimes normal cochleas or normal inner ears where the inner ear functional reserve is normal. Now how do you provide hearing for these people? So the hearing options are bone conduction devices where the cochlea is stimulated by the bone conduction device. Again, it is surgically implanted, and then as an option of hearing is given to the child. Even more safer, if you ask me, because it is just implanted right on the bone. The cochlea is left as it is, so there is no risks for the patient as such. Bone conduction devices are also used sometimes in single-sided deafness when one ear is absolutely normal and they want some form of hearing from the opposite side. It may not give directionality, but it can give a support on the opposite ear. Also in chronic discharging ears, when you can no more do any more surgeries and they have a pure conductive loss, we can definitely provide bone conduction hearing solutions, provided they have a good neural reserve. With poor neural reserve, it is not recommended to give these kind of hearing solutions.
Now, what do you see in the future of hearing loss as of now?
Yeah, so what's happening at this point of time, it may not be in future, it's already happening. A lot of research is happening for hearing solutions. First, when it comes to implantable hearing solutions, totally implantable cochlear implants are coming in the way. So now a lot of people don't want an external device sitting outside. They want everything invisible. So totally implantable cochlear implant devices have been implanted on patients in the trials and found to be successful. So now they need to look how it can be easily brought out into the hearing options available for the patient. Looking at the costs of these devices, looking at the viability of these devices. They're still in their trial zones, and once I think pretty sure that they're going to be successful, and eventually we would have these options. Other options also are available, which are like gene therapies. Recent advances, certain children have been cured of their deafness for specific genetic related hearing loss where the gene therapy was available, but although it is extremely expensive. So these are the newer things that are coming up for people to have treatment options for hearing. That's something which is a good thing to look at. Everything has to be looked at in depth. It cannot be looked at in the form of excitement and then being very happy about it. Everything has to be looked with the form of a question, and then the trials going on, and then how their outcomes are, and then we can look forward to implementing solutions for all the patients.
So what is your message on this World Hearing Day?
So my message is not going to be anything different from the World Hearing Day theme for this year. We need to make sure that first a person is able to take care of their own ears and respect it and value it, because you only have two of them. Reversible hearing loss can be corrected. Hearing loss which can be irreversible because of your negligence or the way you're treating your ears, that will require some form of addressing with respect to devices that you'll have to wear. So you don't have to push it right away to a problem and then come for a solution later. We are trying to guide you to make sure that you don't have issues which can be self-inflicted, like using prolonged hours of headphones and earphones. We also would encourage that in case of any form of hearing difficulties, you do go and address them, just like how you would go for your vision. A small change in your vision, you will be right at the office of an ophthalmologist and then get your eyes checked so that you don't face issues on a day-to-day basis. It is in fact the same or more valuable special sense that you have, which needs to be taken care of. Definitely, I would also say that anyone who comes to you or in your family, if there's a person with hearing loss, please make sure that you respect that person, because the person is having an issue which requires help. He or she should not be ridiculed. They need to be respected. They need to be guided. They need to be told that they have a solution for this problem. If they are not willing, they need to be first made to experience it so that they are able to understand the requirements. Based on how the person is as a whole, you need to address this issue, especially when it comes to the elderly. They have always taken care of us. So when they reach that point of time where they're looking for care or they don't know how to express it, they should be taken care. This is what I would say, that do not ever disrespect a person who has hearing loss because he or she is looking out for help directly or indirectly and they don't know how to express it. So give them all the support, give them all the love, and take care of everyone. Thank you.